Are you a senior citizen, or do you know anyone over 60 years old? If so, today's video is for you. As we get older, it's normal to experience some physical changes. One of the most common issues that seniors face is having weak and brittle legs, which can lead to serious health complications such as frequent falls and fractures, especially in women. But there are certain vitamins that have been proven by science to make your legs stronger and healthier. So if you want to avoid pain, suffering, hospital stays, and also extend the length and quality of your life, keep watching this video. Before we go any further, please take some time to like and subscribe. This really helps our channel to reach more people with nutrition and health tips. Now let's begin. Vitamin D. The first vitamin that we should talk about is vitamin D, also known as the sunshine vitamin. Studies found that low levels of vitamin D are associated with increased risk of falling. In fact, many studies show that maintaining adequate vitamin D levels can help improve balance and reduce the risk of falls in older adults. According to a study published in the Journal of Clinical Endocrinology and Metabolism, vitamin D deficiency increases the risk of fracture in postmenopausal women. The researchers found that women who had the lowest vitamin D levels were 50% more likely to have a fracture than those with the highest levels. It is recommended that people over 60 years old should take at least 800 to 1,000 IU of vitamin D daily to maintain healthy bones and muscles. Fortunately, there are many foods that are naturally high in vitamin D, such as fatty fish like salmon, tuna, and mackerel, as well as egg yolks and certain types of mushrooms. However, it can be difficult to get enough vitamin D from diet alone, especially if you don't live in a sunny climate or you have limited access to fresh food. In this case, you may consider taking a supplement to boost your vitamin D intake. Please keep in mind that everyone's needs are different, and it's always best to consult with your doctor before starting any new supplement, especially if you're taking medications. Vitamin K2. Vitamin K2 is another essential nutrient for maintaining strong and healthy bones. This vitamin plays a key role in the metabolism of calcium, and it helps to prevent the buildup of calcium in the arteries. As we age, our bones become more prone to fractures, and one of the contributing factors is the accumulation of calcium in the arteries, which can reduce the blood flow to the bones and impair their strength. Vitamin K2 has been shown to reduce the risk of fractures in older adults. A study published in the journal Nutrition, Aging and in the journal Nutrition, Aging and Metabolism found that participants who took a daily supplement of vitamin K2 had a significantly lower risk of fractures than the placebo group. The recommended daily intake of vitamin K2 for adults over 60 years old is 90 micrograms. This vitamin is not commonly found in foods, but it can be obtained through some supplements. Some foods that are naturally high in vitamin K2 include butter, cheese, and fermented vegetables like sauerkraut and kimchi. However, the amounts of vitamin K2 in these foods can vary widely, and it can be difficult to meet your daily requirements through diet alone. So, if you want to ensure that you're getting enough vitamin K2, you may consider taking a supplement. Calcium. Calcium is a mineral that is essential for strong and healthy bones. As we age, our bones become weaker and more prone to fractures, and one of the reasons for this is because our bodies absorb less calcium as we get older. According to a study published in the American Journal of Clinical Nutrition, older adults are less efficient at absorbing dietary calcium compared to younger people. This means that as we age, we need to consume more calcium to maintain strong and healthy bones. The recommended daily intake of calcium for adults over 60 years old is 1,000 to 1,200 millimolars, depending on whether you are a man or a woman. Women over 50 years old are recommended to consume 1,200 millimolars of calcium per day, while men over 60 years old are recommended to consume 1,000 millimolars per day. Getting enough calcium through diet can be challenging, especially if you have certain medical conditions or are taking medications that affect calcium absorption. Some medications, such as diuretics and antacids, can interfere with the body's ability to absorb calcium. In addition, people over 60 years old are at risk of osteoporosis, a condition in which the bones become weak and brittle due to a loss of bone mass and density. This can increase the risk of fractures, particularly in the hip, spine, and wrist. So if you're concerned about your calcium intake or bone health, you may consider taking a calcium supplement. There are several types of calcium supplements available, such as calcium carbonate, citrate, and gluconate. Each of these forms has its own advantages and disadvantages in terms of absorption and side effects. It's important to note that taking too much calcium can also have negative effects on the body, such as kidney stones and constipation. Therefore, it's crucial to follow the recommended dosage and consult with your doctor if you're taking any medications or have any underlying health conditions. Other important nutrients. While the vitamins mentioned above are essential for maintaining leg strength and preventing falls, there are other important nutrients that play a role in overall bone health. These include magnesium, phosphorus, vitamin C, and vitamin B12. Magnesium is a mineral that helps the body absorb calcium and vitamin D, all of which are essential for strong bones. Phosphorus works together with calcium to build and maintain bone mass. Vitamin C is a vital nutrient that plays an important role in the production of collagen, a protein that provides structure to the bones. Vitamin B12 is necessary for the production of red blood cells, which carry oxygen to the bones and other tissues in the body. A study published in the Journal of the American College of Nutrition found that older adults who consumed a diet rich in B12 had higher levels of physical activity and functional performance. This suggests that vitamin B12 may play a role in maintaining mobility and independence in older adults. Exercise and physical activity. In addition to maintaining a balanced diet rich in the vitamins and minerals mentioned above, regular exercise is also crucial for strengthening legs and preventing falls in older adults. According to the National Institute on Aging, older adults should engage in at least 150 minutes of moderate-intensity aerobic activity or 75 minutes of vigorous intensity activity each week. Weight-bearing exercises such as walking, jogging, dancing, or strength training can help build muscle and bone mass, improve balance and coordination, and increase overall mobility. Tai Chi and yoga are also great options for improving balance and reducing the risk of falls. Sleep. Getting enough sleep is also important for maintaining muscle strength and overall health. A study published in the journal Science Translational Medicine found that sleep deprivation impairs muscle protein synthesis, which is the process of building muscle mass. Another study published in the journal Current Biology found that sleep deprivation reduces the release of growth hormone, which is essential for muscle growth and repair. On the other hand, getting enough sleep helps to restore muscle protein and strengthens the immune system. Quit smoking and limit alcohol consumption. Smoking and excessive alcohol consumption can weaken the bones and increase the risk of falls and fractures. According to a study published in the Journal of the American Geriatric Society, current smokers are 35% more likely to have a hip fracture than non-smokers. Excessive alcohol consumption can also impair balance and coordination, making it more likely that you will fall and break a bone. Consult with your doctor. If you have concerns about your leg strength or balance, it's important to consult with your doctor. Your doctor can assess your overall health, including any medical conditions or medications you may be taking that could be contributing to your symptoms. They can also recommend specific exercises, vitamins, or supplements that may be beneficial for you. Additionally, your doctor may refer you to a physical therapist who can develop a personalized plan to help you improve your balance and strength. By following these tips, you can support your leg health and reduce your risk of falls and fractures as you age. Remember that everyone's needs are different, and it's important to prioritize your individual health and well-being. Don't forget to like and subscribe, and stay tuned for more health and nutrition tips. Thank you for watching, and see you in the next video.